Florence Nightingale once said, "I attribute my success to this. I never gave or took any excuse." In the heart of the 19th century, a remarkable woman emerged who revolutionized healthcare as we know it today. This woman was none other than Florence Nightingale, the founder of modern nursing. Her contributions during the Crimean War were instrumental in changing the course of medical history. Nightingale's dedication to caring for wounded soldiers, coupled with her rigorous improvements in hygiene and living standards, significantly reduced death rates, marking a new era in healthcare. But her influence didn't stop there. Known for her relentless advocacy for social reforms, Nightingale tirelessly worked towards better healthcare, hunger relief in India, and expanding the role of women in the workforce. Beyond her social contributions, Nightingale was also a pioneer in the field of statistics and data visualization. Her innovative use of graphical presentations to analyze and present data effectively demonstrated the power of numbers in shaping public policy. And so the story of Florence Nightingale begins, a woman who would forever change the face of healthcare. Now, to understand the significance of Florence Nightingale's work, we must first explore the state of healthcare in the 19th century. Imagine a time when hospitals were not the clean, sterile environments we know today, but rather they were grim places, often riddled with diseases. Hygiene was not a priority in the 19th century healthcare, and the lack of it was a silent, deadly enemy. Hospitals were breeding grounds for infections, with soiled linens, unsanitary surgical instruments, and patients crowded together in unventilated rooms. In addition to the dreadful hygiene standards, the living conditions were nothing short of appalling. The sick and injured were often crammed into tight spaces, with little to no access to fresh air or sunlight. The lack of proper nutrition further weakened their immune systems, making recovery a distant dream. Moreover, the nursing practice was far from professional. In fact, nursing was not even considered a respectable profession back then. It was largely unregulated, with no formal training or standards of care. Nurses were often unskilled, and their approach to care was more akin to a custodial role than what we would recognize as nursing today. These issues were particularly pronounced during the Crimean War, where wounded soldiers were more likely to die from infections contracted in hospitals than from their actual battle wounds. The mortality rate was alarmingly high, with around 1 in 4 patients not surviving their hospital stay. This was the stark reality of 19th century healthcare. It was a system fraught with problems where illness and death were often the result of the care, or rather the lack thereof, that patients received in hospitals. In this grim landscape, a beacon of hope emerged, a woman who would challenge the status quo and revolutionize the field of healthcare. Her name was Florence Nightingale. In the midst of these dire circumstances, Florence Nightingale saw an opportunity to bring about change. Florence Nightingale was not one to stand by in the face of injustice. She took action, implementing solutions that would revolutionize healthcare. In the midst of the Crimean War, Nightingale observed the abysmal conditions soldiers were subjected to. The lack of hygiene and poor living standards were not only inhumane but also conducive to the spread of disease. Recognizing the urgent need for reform, Nightingale introduced better hygiene practices and improved living conditions. She initiated a revolution in sanitation, understanding its importance in disease prevention. She implemented hand washing and clean dressings for wounds, practices that seem elementary to us today but were groundbreaking in the mid-19th century. She also arranged for better food and more comfortable living quarters for the soldiers, understanding that physical health is linked to the environment. The impact of Nightingale's interventions was staggering. Death rates in the hospitals she managed plummeted. Her work was a testament to the power of cleanliness and decent living standards in promoting health. But Nightingale's contributions did not stop there. Recognizing the need for professional nursing, she established the first secular nursing school in the world at St. Thomas' Hospital in London. This school provided a structured education for nurses, transforming nursing from a menial task to a respected profession. It laid the groundwork for the nursing profession as we know it today. Nightingale was also a pioneer in the field of data visualization. She used graphical presentations to analyze and present data effectively, a practice that has become fundamental in modern medicine and public health. Her work went beyond the borders of the United Kingdom. Nightingale advocated for better healthcare and hunger relief in India, further demonstrating her commitment to social reform. Florence Nightingale's work transformed healthcare, demonstrating the power of determination and innovation. Her legacy continues to inspire and guide us in the pursuit of better healthcare for all.